If you experience lower back pain and stiffness and have been diagnosed with degenerative disc disease, you probably feel worried about what your future looks like. Don't worry. In this video, I'm going to show you 3 basic lumbar stabilization exercises you can perform to decrease pain from degenerative disc disease and give you the best chance to avoid surgeries, injections, and pain medications. Degenerative disc disease is present in many of the patients that I treat. And while the research shows that in the absence of pain and discomfort, this disease doesn't require intervention, the story changes when pain or stiffness is present. These symptoms can affect every movement you do, most notably walking, standing, and lifting. It really changes the way you interact with the world in a negative way. In most cases, where this pain and stiffness is involved, the major problem is in the stability of the lumbar spine. Research has shown that improving the strength of the lumbar stabilizers is more effective than increasing the mobility of the lumbar spine. And this makes sense. When the lumbar spine is stable, you have more control over your movements. So despite the degenerative disc disease, you can interact with the world safely and without pain or stiffness. You may also be wondering, if I'm feeling stiffness in my back, then how is the problem a lack of stability? And that question makes a lot of sense. When the lumbar spine is unstable, it's usually because the muscles that stabilize it, namely the spinal erectors and abdominal muscles, are not strong or active enough to stabilize it. Muscles in the lower back compensate for this by stiffening up, so your lower back can gain minimal stabilization, but it cannot make up for the global stability provided by the other core muscles. These stiffened muscles stay overworked and overstressed because they were not designed to be the main lumbar stabilizers. Luckily, the 3 exercises I have for you will help engage those inactive and weakened muscles with the hopes of spreading out the demand for lumbar stabilization and reducing pain and stiffness from degenerative disc disease. First, we have transversus abdominis activation. This muscle wraps around your entire torso and is responsible for a large portion of lumbar stabilization. Activating and strengthening this muscle is simple, but at first it's tough to connect to it. To start, lie on your back with your knees bent. Find your hip bones and move your fingers 1 inch in and down. Now, take a deep inhale through your nose, allowing your belly to expand. Then, keeping your face and neck relaxed, exhale through pursed lips like you're blowing into a balloon while pulling your belly button inward. Take your time and get every single little bit of air out of your lungs. As you get that last 10% of air out, tuck your tailbone very slightly while keeping your belly button pulled in. You'll feel the muscles under your fingertips tighten. Do this for 5 breaths. Over time, you should be able to squeeze that muscle by just pulling your belly button in without needing the breathing technique. Then you can progress to squeezing that muscle while sitting, standing, and walking. But remember, this takes time, so progress at your own pace. Next, we have Supermans, which will help strengthen the spinal erectors. All you need to do is lie on your stomach with your arms by your sides. Then lift your chest and legs up for a 5-second hold. You should feel the lower back muscles working. Do a set of 10. This should make them feel tired enough at the beginning, but as you get better and stronger, you can progress to a bird dog movement if you feel comfortable. Finally, we have Cat-Cow. Starting on your hands and knees, pull your belly button in and slowly round your back, holding for 3 seconds. Then, keeping the belly button pulled in, extend your back in the opposite direction in a slow and controlled manner using your lower back muscles, holding for 3 seconds. 5 to 10 repetitions in each direction should be plenty. This movement will help teach you how to use the muscles you've strengthened to stabilize the lumbar spine at the same time it's moving. With all these exercises, remember to stay in pain-free positions and ranges of motion. And as you feel more confident, progress them appropriately based on your symptoms and the guidelines I outlined for each exercise progression. However, if you are looking for a program designed not only to alleviate lower back pain, but any other joint pain, including knee, hip, and shoulder pain that you may experience, check out Pain to Peak, your first line of defense against musculoskeletal pain, by going to paintopeak.com. There are a ton of free resources on the site, including my free ebook, 8 Solutions to Modern Day Musculoskeletal Pain. Links to all of these resources will be in the description below. And don't forget to subscribe and comment with your low back pain and stiffness experience. Thanks for watching.